Okay, let's talk about dizziness. You know, that sudden, really unsettling feeling where the whole world just feels off balance. We almost always blame our inner ear, or maybe something going on in our head, right? But what if the real culprit was hiding in a place you'd literally never suspect?
It's a scary question to ask yourself. Why do I feel so unsteady? It can totally throw off your day, wreck your confidence, and it just leaves you searching and searching for an answer.
Our first instinct is to look for the cause somewhere in the head, the brain or the inner ear. And look, a lot of the time, that's exactly where the problem is. But today, we're looking at a completely different suspect, one that shows us the answer isn't always where we think.
So let's dive into this really surprising connection. The unlikely suspect at the very center of this whole mystery? It's your neck.
I know, it sounds a little strange, doesn't it? But your neck is actually packed with these tiny little sensors. They act like a built-in GPS for your head, constantly sending a stream of data to your brain, telling it exactly where you are in space. It's this incredible system that we're relying on every single second of the day, and we don't even realize it.
So, what could possibly throw a system like that off? Well, it could be something sudden, like a whiplash injury. But it can also be these more chronic, slow-burn issues, things like problems with your joints, inflammation, or just other dysfunctions in your neck that, over time, start to corrupt that data stream to your brain.
So when this kind of dizziness really does come from the neck, what do doctors actually call it? What's the diagnosis?
Well, it has a name, cervicogenic dizziness, and the definition is actually pretty simple, but it's really powerful. It's a syndrome where dizziness and neck pain are directly linked. You can't separate them, one is tied to the other.
And that's the key, you see. It's hardly ever just dizziness. The symptoms almost always show up as a group, like a package deal. The feeling of imbalance comes with neck pain, or you notice you can't turn your head as far as you used to, and maybe you get headaches too. They're all pieces of the exact same puzzle. But, and this is so important, a doctor can't just jump to this conclusion. To get a diagnosis of cervicogenic dizziness, they first have to rule out everything else. I'm talking inner ear problems, serious neurological conditions, the whole shebang. It's what's known as a diagnosis of exclusion. Okay, now this is where it gets really fascinating. How in the world can a neck problem actually make your head spin? Let's break down the mechanism behind it.
So think of it like this. To keep you upright and stable, your brain is constantly trying to match up signals from two really important sources, what your eyes are seeing and the position data that's coming in from all those little sensors in your neck. Here's how the brain's balancing act is supposed to work. Step 1. Your eyes tell your brain where you are. Step 2. Your neck reports back exactly how your head is turned. When those two signals match up perfectly, everything's great, you feel totally stable. But what happens when your neck starts sending bad info?
Let's use an example to make this crystal clear. Imagine you turn your head 45 degrees. Your eyes see that motion, and they correctly report a 45-degree turn to your brain. But because there's some issue in your neck, some tightness or a joint problem, its sensors only register a 35-degree turn.
And boom, right there, that's the conflict. Your brain is getting two totally different stories at the exact same time. Your eyes are screaming, hey, we moved 45 degrees, while your neck is whispering, nah, it was only 35. Your brain just can't make sense of this mismatch, and it interprets all that confusion as one thing: dizziness. The source material really sums it up perfectly. It says that the information from the neck conflicts with what the visual system is providing, and the direct result of that conflict is dizziness. It's kind of that simple and that complex all at once.
So after all that, what's the big takeaway? What does all this mean for you, especially if you're someone who's been dealing with these kinds of symptoms?
Honestly, here's the easiest way to think about it. Your dizziness might not be a hardware problem, like something is broken in your inner ear. Instead, it could be more of a wiring problem. The communication lines between your neck and your brain are just getting their signals crossed.
And that really leaves us with one last big question. If you've been struggling with dizziness that you just can't explain, and especially if it shows up with neck pain, it might be worth asking yourself, could my body's wires just be crossed?